Today is your 2024 Open Enrollment Survival Guide. 2024 Open Enrollment kicks off next week, as we all know. So let's get right to it, okay? And little housekeeping. Okay, we're gonna take questions at the very end of the presentation. We got a lot to go through, and there's gonna be a lot of content, and it'll spark some new questions. And in fact, we'll probably answer a lot of your early questions throughout the present. We'll be able to answer a lot of your questions with the content. So, I'm your genial host, Jeff Beglin, and here's the other information. Brad, new to the team, he is our business development manager for Northern Ohio. And of course, Eric Pouncey is our broker specialist. He keeps us in the fairway, keeps everything clean and green. So there's our information. And by all means, if you've got any question, just reach out to us. Okay, as we all know, open enrollment kicks off next week. Okay, and it runs through January 15th. So just a couple things I want to go through, and then I want to kick it over to Eric real quick. Let's talk about the Affordable Care Act. Ohio residents covered by the marketplace, almost 300,000 as of 2023 versus merely 180,000 back in 2020. Pretty big growth, and this is indicative of what's taking place nationwide. So, and then the other thing to consider is about 300,000, maybe 250,000, depending on who you talk to, are getting Medicaid redetermination. And a big portion of these will end up on the marketplace. I'm sure you're seeing a lot of these. And this is a lot of business coming your way. So the ACA, it's here to stay. So let's go to the next slide. And that is what the opportunity is all about. So I want to point that out. So 300,000 people facing redetermination. Let's get out there and avail ourselves to that opportunity. And I did want to point out something before we kick it over to Eric. FFM certification, it's still available. We've got a link there for you to click on. Everybody will get a copy of the presentation later. And you can click there to get certified, okay? You're a new user, and you need to change your password every 90 days. So then there's a place for you to track it here, okay? And then I also want to point out that they've got this wonderful service, and a lot of agents are using this. I want to point that out. This is baked into healthcare.gov. It's called Help on Demand. It's a referral system that they have created, so you don't pay for it. And agents and brokers who've completed the marketplace training are eligible. And how it works is when the consumer is out there and they're struggling with healthcare.gov, or they just got questions or whatever, they can hit a button and say, let me get help on demand. And so, they will send a signal out to the agents in their geographic area. So you'll get a message on your phone that you need to, contact a client and, follow up on his questions and things like that. So more about that following this link. It's a great way to generate business. It's free, and we're getting a lot of activity from this already. So agents love it. So Eric, take it away.
Yeah, thank you, Jeff. So here we are with our Health Sherpa platform that we use. It's the largest ACA agent enrollment platform in the country. Their main feature is the enhanced direct enrollment, which allows you to quote for your client straight on there and go straight into your enrollment. There's no redirect anymore that they used to have on there. You can upload documents for your clients, and everything is pretty much automated for everything on there. If you're with an agency, you could do NPN overrides for them as well. And then they have a couple renewal tools that they use that kind of get those documents out quick, and it will automatically do that for you if you hit subscribe on their platform that's showing all the renewals. So that'll be under your client screen. And then on the right-hand side, it'll say renewal, and you just check that box, and then it will send it out. And then just more about Health Sherpa. Just here are some numbers. I guess the main thing to point out would be the primary applicant of the ages. So our biggest there is the 50 to 59-year-olds is 27%, and that's probably our highest right there. And I'd say that's still up to date for today's standards as well. Our median age is 48, and then those average applicants 1.4. And then we hit what else?
Next slide.
Yep.
Okay, so I'm going to just give you a little public service announcement. COVID era enhanced subsidies are really what's driving a lot of these sales and what's driving a lot of this increase that I talked about earlier. So these are going to be extended through next year and the following year. So, you know, while they're still here, make your clients aware that, you know, they're getting an enhanced subsidy. They're getting a little extra, and it's really because of COVID. Okay, so there's a little more money out there for clients to take advantage of. So be sure they know that. Okay, and then I do want to just give a quick illustration of what we're talking about in terms of the federal poverty level. Again, this is the benchmark where we start to generate the premiums, and the important thing to focus on is 138% poverty level, because this is the FPL benchmark used in Ohio and Kentucky, and this is where things land for this. This is just another resource we put in here so you can reference this in your education as you go on. So this is going to be a resource. Everybody's going to get a copy of this slide deck for their benefit, and there's a ton of information out here. So that's what it's all about. And then another public service announcement, and I know we're kind of all over the place, but that's kind of how this year has been. There's just been one thing after another. You know, Medicaid redetermination. Now, the government has really stressed that it's a requirement now that agents provide more or less a scope of appointment for the under 65 market. Okay, so this is kind of what this is, a scope of appointment. That's another way to reference this, but it's an FFM consent form. You've all learned about it. It's highly addressed in the FFM training. And, you know, I'm sure everybody has seen this sample consent form. I'm not going to waste a lot of time on it, but you need to do this with every application, okay? And you need to get a consent form on file, even for your existing clients. You need to get this on file. It needs to stay in your records for 10 years. And it's a form, okay? Then this isn't really a sample form, okay? I want to stress, you don't use this actual form. You can use the language in it, you know, maybe artfully recraft some of the words. You can use, you know, heck, everything, almost word for word, and that's still compliant. It's a two-stage process. You get the client's consent early on to work on their behalf, and then at the end of the application, of your FFM application, you do another attestation of accuracy. And not only can this consent form be in the paper form like this, which you would create, or it could be a recording. You could just read this to them and record it, keep it on file for 10 years. Or you can even do things like a text form. So they stress that, you know, they want this to be authentic and you create it. I know a lot of guys will use this basic template as, you know, the basis for their form. So there's some other really cool tools out there. And there's a company called Snap Health that, you know, for subscription, they do the consent stuff for you, not unlike what they're doing. There's another company doing this in the Medicare realm, if I'm not mistaken, Brad. there's another resource out here called JotForm. You can create like a fillable template that way, or a fillable thing, a widget. Any questions about this, give us a call and we can walk you through it. Just another
And oh, by
thing.
the way, Health Sherpa allows you to upload and store your consent form right on their platform. So another easy way for you to store.
Thank you, Brad. I did not know
You're
that.
welcome. I did their training twice.
I did not know that. Yeah, and you know, people are asking, well, why doesn't Health Sherpa just bake this into their broker app? They didn't do that. If you go on Health Sherpa, you still got to use your form. You know, so the feds, it's the scope of appointment, guys, and you'll find ways to make this process easy. It won't really add too much time to your work. So put your questions in the comments, and we'll get to them at the end. What you think about the form? So Brad, take it away.
Sure. All right, everybody. Really on this slide, it's more to let you see what we have available. Dental has become so important component of healthcare coverage. So we have a pretty great assortment, I think, with 7 different carriers that you could use for standalone dental plans. They all have really good networks. A number of plans at a few different prices. I think the lowest I've seen is high teens, all the way up into the 60s. Again, as you go up, the more max out of pocket you have. So if you want to take a look and just go out to their consumer site to see if it makes sense, and then if you want it, just let Jeff, Eric, or I know, and we will have Sandy Weber add that, send you contracting links, get that together. Also, short term, lots and lots of buzz around short term, right? So the 3 that we have, obviously, United Healthcare One, or UH1, formerly the Golden Rule Company, and then there's Allstate, which was formerly National General. It's kind of funny, there's a lot of formerlies in here. And then, of course, Anthem adds their enhanced choice plan. And I think, you know, we know that UH1 has always been a little conservative in their underwriting. You know, with pre-X, they're really, really tight on that. Where with Anthem's enhanced choice, you know, Nancy Kazenko, who you've probably heard on some of our presentations or seen out in the market, she said with Anthem enhanced choice plans, if they get approved, they're not gonna sort of put their throat or their foot on anyone's throat for pre-X after they've been approved. So you're either approved or you're not. So that makes it pretty easy to give that assurance. And then next slide. And I didn't really mention National General. Their rates look pretty good, and I think the nice thing about all of these short-term plans or their enrollment platforms is they allow you to add other things, potentially like dental, right on the platform. So they're getting all of their ancillaries in one place, if it makes sense, as well as adding critical illness, cancer, heart, stroke, critical illness plans. So you know, with these high deductibles, high max out of pockets, I would not leave any of your clients exposed for a little extra money in their monthly premium, especially if they're getting a higher subsidy. And usually they're getting a higher subsidy, money's a little tighter. So this is just like any insurance. It's a great just in case. Next. So one before, sorry. I went back. So obviously, the proposed rules on short term are now closer than ever, right? So here in early December, all the legislation is going to be really coming to bear at that time, where it's already been through the discussion process. I think we're waiting for that final determination, and everybody that we talk to, you know, pretty much verify that it's going to happen. And this is, you know, much to the disdain of all of the carriers that offer short-term plans, because this is a large segment of their business. But I think the biggest rule is it's giving people, it's truly going to be as it was originally intended, short term. 3 months is the term with an additional month to be extended, or if extended, excuse me. So I think the really important thing here is that it wasn't widely known, and we did a little digging. CMS, FFM does not have currently a special election period or special enrollment period for loss of short-term coverage. So it's not really a qualifying health plan in their eyes. So just be careful that you don't leave anybody hanging out there without that SEP that they could use to get on to an ACA plan. Okay, so truly a bridge between employer coverage or bridging to Medicare in a short span of time. So just be careful. I know all the carriers are offering large bonuses on writing short term, but it could put your client in a pickle. So let's keep moving, Jeff. Okay, target markets. Hopefully, you probably already know this, but who are we looking at? It's early retirees. It's that younger spouse of a Medicare turning 65. For millennials, for the younger people who their parents no longer, even though they're 23 to 26 years old, no longer want to pay for them. And they're going to say, you know what, go out on your own. So these millennials are now a good opportunity, as well as recent college graduates who the parents are out of money and they're saying, like, I'm going to be in a few years after paying for college, that, hey, you're going to start paying for your own health insurance. The good news is that again, based on income, the lower age premium is a lot more affordable, especially when they're healthy and can go with, you know, a higher bronze plan. New families, new residents to the state, obviously those going through Medicaid redetermination. There are quite a bit of opportunities. However, everybody asks me, well, Brad, you know, how do I market to this group? And you know, if you've all seen, healthcare.gov has a really great TV commercial that pitches healthcare.gov or pitches the FFM plans. However, none of us have the budget to do that kind of advertising where you can target such a wide swath from, you know, 0 to 64 3/4. So it's kind of tough. It's really about being available, being out in the market, and having your face or your business be known in the community is really the best way to get to these clients. Next. All right, if you're not familiar with this, known in the industry as ICHRA, which stands for Individual Coverage Reimbursement Arrangement, Health Reimbursement Arrangement. Looks like we forgot a word there. So what this is it is a sort of group funded plan or employer funded coverage that allows the consumer, their employees, to go out to the marketplace, find a plan that fits their needs, because maybe the employer can only offer 2 or 3 choices, or in some cases, they're only offering 1 choice. And I think why these are becoming more and more popular, we're on now year 3 of generally everything that we hear are year over year high rate increases, and it becomes unsustainable over a 3-year period of time where an employer is looking at a 40 to 60% rate increase over the last 3 years. It becomes unsustainable. So they're going to say, hey, we're going to give a certain dollar amount to every employee, and they can have classes of employees, maybe hourly, maybe salary, management, if it's a warehouse, sort of floor or warehouse workers, whatever their classes are. There's a lot of rules around here, but this is where we can help. We actually have a tool that we use called NextBen. We're always on the make to try and find another resource to do these enrollments, but we can definitely help you with these enrollments. Where do you find them? They're your customers. They're some of your friends that have a small business that you can approach and say, hey, would you like to just say that I have 10 employees and I give each one of them $500 a month to go out onto the marketplace to shop for a plan, then they know that they have a fixed exposure every month that's not going to affect them. So subsidies still apply to the consumers. I think after the open enrollment period, probably in January, February, we're going to do a whole training on ICRA. That way it will help you. So Jeff's happy about that idea that we have new content available. So that's great. Let's keep rolling. All right. So the market footprint for the 2024 year. This is something interesting. Our boss, Luke, found, or our Vice President Luke Bumker found a few weeks back, and it's really cool. And so I listed here mostly the carriers that we market, and there's also one included that we don't presently market, and that's that company that's got a couple M's in their name. But in terms of market share, they have a large market share of 16%. But as you look at this, you could see that Ambetter and Anthem at 20% market share are leading the way. Now, if you look over to the right, and this might be actually a great snapshot to take just for now on your phone, but the average preliminary rate change, okay? So it's average. Some counties, some markets may be higher, some may be lower. For instance, Oscar, it's 6.54 average, but we already know in Cleveland it's going to be closer to 9 or a 10% rate increase, okay? So it's going to be variable there. United Healthcare, and as large as a company as they are in Ohio, this 2024 will be their second year, so they're a little bit small, and so they've been able to keep their rate change fairly low. But you're seeing the average is anywhere between 5 and 7% on average between all carriers. And as you look, our friends at Anthem are delivering a pretty high rate increase, 12.5%. So that's fairly large. Now, the good news is we have a very busy beaver on the team who was out on healthcare.gov this morning, and all of the plans and the rates are out there. So if you
Hot
want
off the presses.
yeah, hot off the presses. So those are out there, and we're going to show you a slide of the lowest silver plan premium so you can get an idea of where they are. We're going to that was a late addition, so it's not in the slide deck, but we're going to show it to you in a bit. And I think the premiums don't look too bad, especially if there's a higher subsidy where it could make it more affordable. All right, so if you haven't heard from me or Jeff or Eric about Aetna, there's a new entrant into Ohio. There's been quite a bit of buzz about it, probably since August when we first got the announcement. We don't know the commission yet, so that's interesting. But you can see the markets they're in, pretty much Northeast Ohio from Ashland out to Ashtabula. They're in 3 counties around Toledo, and the Columbus metro area, as well as Cincinnati and kind of east down the Ohio River that you see. So the plans that we've seen look good. We don't know the rates, although I think Luke was able to put one in there, I hope. But some of the highlights of their plans: members are going to have access to go to CVS Minute Clinics around the state to get sort of that semi-urgent care, pink eye, any kind of laceration, I'd go to an urgent care. I don't think the nurse practitioner is doing any stitches there. They're also going to be offering a $25 per quarter over-the-counter benefit at their CVS stores, as well as they're offering zero or low-cost generic drugs, and the list looks fairly good from what we've seen in the training. So what's their network? You can see it all there. Akron, they've got Summa, they've got Akron Children's. In Ashland, it's Samaritan. In Cincinnati, it's Mercy Health and it's Jewish Hospital. In Cleveland, really everybody's happy about this. They've got university hospitals, which includes Rainbow Babies and Children, Southwest General, Metro Health, and Ashtabula is not well represented in the marketplace, but they have Ashtabula Medical Center in the network. So Ashtabula can now have some good ACA plan or another ACA plan in the market, as well as Worcester Community Hospital. And down in Columbus, we've got Ohio Health, the Methodist Health System. They go by several different names, plus Memorial Hospital of Union, I guess it's Union County, as well as Licking Memorial a little bit further out to the east. And in Toledo, it's Mercy Health and Henry County Hospital. So that's Aetna. If I don't know if they have any trainings. I think their last training was yesterday, but the good news is that we're going to have a training with Aetna, I think tomorrow afternoon at like 2 or 2:30, Jeff, if I'm not mistaken. Sorry, I've challenged
Right,
you.
no, it is tomorrow
it's in the
afternoon.
Or it's 3 o'clock, something
Look for
like
the invite. I think it's
look
that
for the
time frame.
invite. I think
Early
the
afternoon
invite
time
just
frame.
came out from Cornerstone this morning, or a reminder, so that's coming up. All right, I think, Jeff, we're going to kick it over to you to talk about
Thank
Ambetter.
you. We're
You're
just like
welcome.
two guys talking about insurance. So, and I want to point something out to everybody. These networks, these are factually accurate at the time of publication, but like everything, they possibly could change. So we want to stress that everybody do their research when they're looking up doctors and go to the carrier website. Go to the carrier website. The websites that that healthcare.gov uses and Health Sherpa uses, they're not updated because they rely on the carriers to update them. But the carriers have to keep their networks accurate. So just let's talk about Ambetter. Okay, we've got a lot here. Ambetter's been a powerhouse in the ACA industry. They're the industry leader when it comes to sales across the nation. And by the same token, they're the number one or number two carrier in Ohio. So they have been a very important carrier for a lot of agents. And let's talk about commission, $20 per member per month, both Ohio and Kentucky. And in Ohio, they've added Monroe, Noble, Perry, and Wayne. They've pretty much got 90% of the population covered in Ohio. Network-wise, Cincinnati, they have the Tri-Health system, Mercy, and UC. I want to add Christ in there. I think that was left off the slide. They do have Christ in Cincinnati. And then in the Cleveland area, they have Metro, Lake, well, St. Vincent. That system isn't. Oh, I think they've changed, haven't they, Brad?
It's just outpatient. It's no longer a hospital.
Yeah.
So,
and then and university, and then of course there's in Columbus, it's Ohio State. In Dayton, it's the Kettering affiliates, and then the rest, Toledo, they've got the Mercy system up there. Northern Kentucky, St. E's. Okay, Northern Kentucky, in fact, the state of Kentucky, they're pretty solid. So by and large, our agents are just working in the northern tip of Kentucky, but we've got agents also throughout Kentucky. And by all means, contact us if you have any questions about Ambetter.
Yeah.
Always
and they added several counties in blue there. You can see in Kentucky.
Yeah.
Where in Ohio it was only the 4.
Yeah. And then Ambetter, Michigan, I want to give this just a little coverage. They're strong in southeastern Michigan, and also over in western Michigan, they've got Grand Rapids, which is kind of a mushroom community. They're growing. Grand Rapids is growing leaps and bounds. So Grand Rapids in Michigan, the Hoosier State, where I went to college, the proud state of Indiana, that is full coverage, statewide coverage. Okay, and they're very strong network-wise. You'll have to consult their website for that. And then let's just touch on Anthem. They have been the industry tradition, powerhouse for 50 years, 40 years in the individual market. They basically built the individual market, and to this day, they're very strong in Ohio. $18 per member per month. I want to point out that they capped that after, this is a bit of a typo, but they cap it after 2 members, 2 policies per, actually 2 members per family. Okay, so after 2, they cap that commission. And then touching on the networks, Cincinnati, they have the Christ, TriHealth, and UC. Cleveland, they'll do Metro, and St. Vincent again, like Brad pointed out, is dormant, but they've been regenerated as another entity. Mount Carmel in Ohio Health in Columbus, Kettering and Premier in Dayton, ProMedica in Mercy, and let me just take a pause real quick. They have a robust network. Sorry, guys. In Anthem, Kentucky, we're still getting detail on their commission, but Northern Kentucky, St. E's, Louisville, they have Norton and U of L, and then down in Lexington, they have UK and Baptist. And again, Anthem very strong on the Hoosier State. Aside from Southeastern Ohio, they're still not in that neck of the woods. But in Indy, they have IU Health, Clarion. We're still waiting for them to add Southeastern Ohio. And
Indiana.
then Brad, I'm going to toss it to you and get some water.
Yeah.
And
Yeah, sure. All right, thanks. All right, everybody. This is the brand newest entrant into the Ohio marketplace. They are actually also going into Arizona. It's called Antidote Health. We did some trainings live in Cleveland and Columbus, kind of late in August, or early September. So you may not have caught that. We didn't have as many people live, but we had several of you on our virtual training. So Antidote, think about it as a virtual first carrier, right? So they have a 3-tier provider network where you start with virtual, 0 cost. The virtual providers, and they are doctors, they're not nurse practitioners, they're all America based, and I think overnight it rolls to Israel, which anyway, I'm not going to dig into that hole, but so if that virtual provider refers you to a network provider, brick and mortar provider, you're going to get a low, or in the case of PCP, no cost referral. If somebody wanted to eliminate steps 1 and 2, they can go directly to the brick and mortar providers, but it's going to be at the full copay. I think 75 for a specialist. I think it starts on a bronze plan, it's as much as 150. Gold plan goes down to 50, and PCPs are a lot lower. So here's the deal. As of last night, they still have not received their final CMS approval. So this is making it kind of putting it to the end. We were hopeful over the last few weeks they would have gotten it, but stay patient. We'll let you all know when they go live, or you will see it live on Health Sherpa or healthcare.gov. We hope you use Health Sherpa. It really makes your life easier than healthcare.gov. And if you don't know it, we've got a resource center. It's got a Health Sherpa training, actually probably 2, one from recently and one from last year. So they're network. Why do the brokers that we've talked to want an additional carrier that gives access in Northeast Ohio to the Cleveland Clinic? That's what everybody was most happy about, is that just having another alternative to Oscar. Not really dissing any carrier, but they just wanted another alternative. So in Cincinnati, their network is only at Mercy, so it's not as robust of network. In Cleveland, you see we also have Akron Children's and Mercy there as well. In Central, it's a pretty good network with OSU, Mount Carmel, Nationwide Children's, and then once you get east of Metro Columbus, it's the Genesis Health System, which will take you sort of in that Zanesville, Cambridge, over to the Ohio River, Belmont County-ish area, which is like Martin's Ferry. So it's the Genesis network. I haven't gotten to look to see how many hospitals they have in the system, but I got to believe they have them in all of the major communities there. So that's Antidote. If you think you want it and you haven't gotten it or added it to your portfolio yet, let Jeff or I know, and we will get that moving for you. So that's it on Antidote, and we'll answer questions. I'm sure they're coming up a bit later. So Jeff, CareSource.
Okay, let's see if my voice holds up. Okay, sorry guys. Let's talk on CareSource. You know, they made their bones in the Medicaid area. As a result, they've been able to leverage some of these contracts into some really powerful networks. You know, in Cincinnati, they're the only one that has Children's Hospital. I'm told that maybe MedMutual may have added them. I'm not sure, but they're, to my knowledge, they're the only one that has Children's Hospital, which is a flagship pediatric hospital and ranked as the #1 pediatric hospital in the country. So Southwestern Ohio CareSource is an important is an important component. $21 per member per month. Up in, you know, Cincinnati, they've got, in addition to Children's, they've got UC, Christ, TriHealth, and Mercy. Cleveland, they've added UH, and that's a big win for them. In addition, they've got Rainbow Babies. They've got Metro. And Columbus, they've got Ohio State and Nationwide Children's. Kettering, they've got, I'm sorry, in Dayton, they've got both Kettering and Miami Valley. And in Toledo, they've got 2 systems up there. I noticed they have taken pretty big rate increases, as Brad pointed out early. So bit of a trade-off. They're kind of pricey, but obviously what's driving that is some of these, you know, super hospitals systems. And touch on Kentucky for a second. $22 per member per month. They're in Northern Kentucky and pretty much throughout the state. In Northern Kentucky, they have St. E's, which is obviously in Northern Kentucky, but they also let you cross the border into Cincinnati and go to Cincinnati Children's. And there's maybe a couple other Cincinnati providers over here. Okay. And they've got UK and Baptist down in Lexington. So next slide. Also in the Hoosier State, kind of like Ambetter, they pretty much cover the entire state. And IU Health, that's like the powerhouse in that state. They are the #1 provider in that state. And in southeastern Ohio, we kind of like to call that part of Cincinnati. They've got St. E's, okay, which is based in Northern Kentucky, but has branches in Southeast Ohio, Southeast Indiana, and what's more, they've got Cincinnati Christ. So, Molina, I'll touch on them for a little bit. Hope my voice doesn't blow out, but so $16 per member per month. Molina is another good carrier that has done a good job with leveraging their Medicaid contract and some nice hospital systems and offerings. The one characteristic about Molina is they don't offer a bronze plan, but they do offer a very good silver plan and some rich benefits. Be sure to check out their benefit grids. Really stress the silver plans with them. They're a good value with them. The network is stronger in Central and Southwest Ohio, and they've increased their premium this year to $16 per member per month. And there we have the networks. Okay, I'm going to take a quick drink and then move to the next slide. And then here we are. You guys can hear me, hopefully. Here we are with the Molina, Kentucky offering.
All right, while Jeff goes in a coughing fit, just filling in on Molina, Michigan. Here, the commission's $24 PMPM. I don't know why it says they have University of Louisville in Michigan, and I don't know that
That's
Norton's actually.
That's a typo. My apologies. Okay, I left that on there. Sorry about that. Thank you, Brad, for taking over. And Brad,
Yeah,
just in time for my voice to blow out. You could talk about.
Jeff's fighting some bronchial thing, so we're just trying to keep him whole for a little while. So moving over to Oscar. What's to say about Oscar? We all know that their premiums are on the high side, and they are such because they're giving access primarily to the Cleveland Clinic. That's the partnership that they have. It's paying $18 per member per month, and commission is paid direct to the agent here, as well as, so again, Cleveland Clinic, Cleveland Clinic, Cleveland Clinic. In Columbus, there are some Cleveland Clinic affiliates. We didn't put that there, but there's also Mount Carmel and Nationwide. I think for Cleveland Clinic in Columbus, it's more outpatient. So if anybody needs inpatient, they'd be driving to Cleveland. So they have expanded a bit. As you see in Cleveland area, they've added Wayne County to the West Medina. They've also moved down into Stark County, as well as Tuscarawas County, down in Dover, New Philly area. And then around Columbus, they've added some more suburban, sort of to the northwest with Madison, Perry, and Union. I think you're all aware of Oscar and what they are. So details are not tremendous. Their training was a bit brief, in all honesty. So there's an alternative if we can get it approved. So that's it for Oscar. Jeff, anything you want to add on Oscar that you have more breadth on?
No, that's a great summary. And I do want to point out, we're seeing a lot of questions. Thank you for those questions. Keep them coming. A lot of good questions out there. We're going to get to those in a little bit. And
Okay.
You want to touch on
All
United before my?
Yeah, sure.
Okay.
So United Healthcare, they've done a pretty decent expansion into the Cincinnati market as well, in the Columbus market, as well as kind of bridging the gap between Cleveland and Toledo, and in that sort of Lima area as well. So it pays one of the highest commissions at $25 PMPM. Commissions go direct to agent. They do have an annual $100 reward debit card. So members, doing their PCP and other screenings will earn them that reward card. They're also getting a 20% discount. So it's an unlimited discount at Walgreens on any approved OTC item. And we all know that from my United Healthcare days, that in Walgreens, they're all really labeled well in yellow that says approved for OTC. So that discount is nice. They could use it all year and I believe it's just on Walgreens private label products, if I'm not mistaken. Also, members are actually getting a free, I hate using the word free, a zero cost complimentary AARP membership. So that's also thrown in there. What does it give? It gives consumers some additional discounts on travel, dining out, movies, etc. And so we see that in Northeast Ohio, they have had Metro and Mercy primarily. So that's where it's been a little bit tighter, but as they're moving down into Akron, we've got SUMA, we've got Akron Children's, and in Columbus, there's Mount Carmel, and the provider network, COPC, Central Ohio Provider Corporation, I think it is, as well as in Dayton, they've got Kettering, In Toledo, they've got Mercy. University of Toledo was a new addition, as well as Fisher Titus kind of there in the middle. And that's UHC in Ohio. The plans are actually very nice plans from what I've seen. It's just sometimes network, I wished it was a little bit richer. And I know they continue to work on that, but things move slowly sometimes. So next slide. So Michigan, there's not a whole lot of detail here, but from what I saw the past year in Michigan, the plans pretty much mimic what they are in Ohio.
Right.
So they're only in 6 counties in the state. So that's pretty much
not
Detroit
in Detroit.
Metro. Well, it's Metro Detroit up to Troy.
Yeah, I guess that is
Farmington Hills. It's Grand Rapids, and it looks like it's that Kalamazoo area over in southwestern Michigan. So
yeah.
Yep. So that's UHC. We don't have a ton of agents in Michigan, but
Detroit.
you know, yep. And again, I think this is this you or me, Jeff? I can't remember. I've got to look at my sheet.
I'm losing my voice. If you could jump in.
Okay, yeah.
Sorry about that.
Okay. So if we have a program called Autopilot, and so if you're not licensed or appointed in other states, you know, maybe you are in the neighboring states, Pennsylvania, West Virginia, Kentucky, but you don't have Maine, you don't have Wisconsin, you don't have Texas or Utah. We actually have a team in Cincinnati and Columbus that works on strictly referrals, right? So you as a broker or some of our commercial line brokers who don't want in the Medicare or ACA business will actually refer that to us. The good news is if it's written into the contract, if they're, you know, when they're T65, we can give it back to you. So that's all in the contract. So you have to make sure that your contract is as you want it to read. So it's a nice resource because we know that some carriers charge appointment fees in other states, and you know sometimes they could be upwards of $150 per state, and so you really have to think about the commission and if the appointment fee and the licensing fee are worth the commission. So just simple math. Next slide. So this is really we call it the ASP program or agency services program. It actually has another component to it as well, not only the referral program, but succession planning. So if you're nearing retirement and saying, I do want to enjoy the beach, or I do want to enjoy the mountains for skiing, whatever, and you're just tired of the last 30 or 40 years of your life, we can actually talk to you about assuming that book of business for you, as well as we have a flight plan program, which is really just resources for your retirement. So this is a good program. A lot of brokers over the years have taken advantage of this opportunity. So if you're starting to think about it, let us know and we're happy. But that autopilot, we have quite a few brokers who use it for a variety of reasons. So consider it if you need it. We're there. It's a simple contract. It's a non-binding contract, meaning if you decided that you wanted to jump back into something, you can, okay? And we're gonna pay you basically 20% of the monthly premium, or excuse me, of the monthly commission, not premium. So that's not a bad deal for not having to touch anything to deal with it. So for just say ACA, you're getting roughly somewhere between $3.50 to $5 in a few cases, but $4 is probably a great average. And if you're referring some Medicare business, well, it's 20% of the renewal rate of $300, so $60. Again, for not having to get licensed and appointed in the other states. So that's the ASP program. Next. So I guess I kind of already talked about this, so I don't really need to talk about it, other than what I forgot to talk about is if you're not in the group space, we can help there too, right? It's not your specialty. What you have to really think about, You know, you think you know somebody that works at a giant corporation, and you, solo operator broker, are going to go against the giants in the industry of Aon or Oswald or Arthur J. Gallagher. They're kind of protective, but we are in that space as well with our commercial team. So we can help and also do that same kind of referral program where we're still paying you for the referral at a nice rate. So that's something to consider as well. Jeff, am I really leaving anything off there that I haven't talked about?
No,
I don't think
that's
so.
great. That's
All
great.
right, good. All right.
Yeah.
And AGB. So for any of you that are already contracted, you already have access to the agent portal. It's where you see commissions. It's where you see your book of business. It's available. You can link it from the Cornerstone website, the resource center, where you go to the resource center. So that's an easy access for you to use 24 hours, 7 days a week. It's got all the carrier forms, some marketing materials, and everything that I mentioned there. So if you don't have AGB yet, or you forgot that you have it, let us know and we'll get you right there. So anyway, that's AGB.
Okay. You
All
know
right.
what? I got
What?
something to share with you. I think we all have something to share with you. Drum roll, please.
Oh, that's
Before
right.
we get to the questions, let's talk about what dropped on our doorstep just a few minutes ago. We're going to show you some rates. Guys, we're going to show you some rates, 2024 rates, hot off the presses.
Drum roll.
We might be the first GA to have these out there. Okay, can you guys see the screen? This is a summary. We did.
Hey, Jeff, can you make it a little bit larger, lower right-hand side of your screen, and just
Um,
increase that size? Because see the little slide bar down
okay,
there?
yeah,
Yes,
I mean,
sir.
yeah. Is that too
Look at
much?
that.
Is that
Yeah,
too
look at
much?
that.
Too big.
No,
Yeah.
that actually takes just a wee smidge less.
Just a wee bit. Eric, how we doing?
There you
Just
go.
make it
Oh,
a
too
little
much.
smaller. There
Good,
you go.
good,
That's
good,
fine
good.
right there.
Okay, right there. Okay. All right. So guys, I'm gonna, toss this to Brad in a second. This is like Christmas morning. Getting rates is kind of an exciting thing. This is the 14th year. Am I right? No. No, this is like the 11th year of Obamacare, the ACA, here to stay, like I said earlier. And we always eagerly await when the rates come out ahead of time, because we've been waiting for this for months and months. And where are people going to land? Where are the carriers going to land? So what we did here, and thank you, Luke Bemker, our boss, he crunched the numbers while we were here talking. Okay, he crunched the numbers and put together a spreadsheet, okay, for 2024. And it looks like 7 select metro areas, and it looks like he used a 42-year-old male as a sample. And I want to point out that there is no subsidy applied here. So what are your findings? What do you see out here? What jumps out at you, Brad?
Right. And I would really say, guys, there's a lot of numbers and I could read them all to you, or you can just take a picture with your phone so you could really, really absorb it. But how it's arranged here, green is the lowest silver plan with a $5,900 deductible in that county / market. As then in gold, it's the second lowest. And in blue is the third lowest premium. So for example, in Hamilton County, it looks like Oscar is actually the lowest rate. So remember, I said that they had that sort of 7-8% rate increase. So it may be higher in some counties, but in some areas, like here in Cincinnati area, it's 405, followed by 414 for Molina, and Ambetter at 425. So you can kind of see when you look, sort of the low plans there are under $450-ish, and there's a couple that are higher based on some of the things we talked about, like CareSource at 507 in the area. Moving over to Lucas County, so in the Toledo area, 455 is that low number, 460 is the mid number, and 465, so all very close. So here, CareSource comes into the top 3. Then we go down into Columbus and Franklin County. You can see the premiums are a little bit higher in Franklin County, with the lowest being 455, second 486, and the third at 510, Cuyahoga County. So you could see a wide swath from 412 all the way up to $600 for our friends at Anthem. So that's a pretty good spread between 448 and 464. So in a very, 412 up to 464. Then we move down into Akron, here a little bit higher, at 459, 471, 508. And then we go over into Youngstown, Mahoning County area, and we're looking at 445 to 472 for the top three. But you're seeing some of those higher premiums, just shy of somewhere between the $500 and $600 range. So, if somebody gets a decent subsidy, even a few $100 subsidy, it's going to make that that net premium a few $100. So, or actually 200 or $100 to $300 in most of those cases, with a $300 subsidy. So we think this looks pretty good. I hope you've all taken a snapshot of this. I don't know how we can get it out in print to you. I don't know if we can put it on the website for you to download. We'll figure out a way to get it to you.
Okay,
Am I
great.
missing anything?
No, I'm going to leave this up here for now, and then I'm going to get to some questions. Let this sink in a little bit, prime some questions. So Jennifer's got a great question. And if the short-term rule goes back to the 3-month limit, when it is anticipated to go into effective date? Well, technically it could be as early as December 11th, if you do the math. It's like 90 days from the the comment that they have to take the comments and then digest them and make any changes, and there's a 90-day period. So the comment period ended on September 11th. And next question. And honestly, I think it's going to be January 1st. And honestly, at this stage of the game, I think it's going to be implemented. I've talked to all the different short-term carriers, and they're planning on it being implemented. Despite the fact, we've written dozens and dozens of letters. I'm not really going to weigh into this whole topic too much, but my theory is once they do impose it, there's going to be a bit of an awakening. I think there might eventually be some adjustments. So stay tuned, but I think it's going to be a fact of life that it's going to be a 3-month limitation starting January 1st. Okay, the next aspect of the question is what would happen to those in that term?
So somebody bought a plan this last June.
Yeah, can you talk on that?
So this is a tough one because yes, they have the short-term plan, but as I said earlier, based on today's knowledge about a special enrollment period, there would be no special enrollment person when this term expires. And Jeff, jumping from carrier to carrier, is that still going to be permitted? You're more well-read.
Actually, no. I got advice on that. Okay. We talked to industry insider. They're not going to let you just enroll in one plan for 3 months and then change horses and go for another carrier for 3 months. I don't know how they're going to police that, but that is part of it. You're not going to be able to just cobble together 4 different short-term plans over
a year of short-term.
So that's a very good point.
Yeah, Jeff, thanks for that. Yeah, so I mean, again, today with no special enrollment period available for somebody, may want to be considered to start looking at that ACA plan maybe sooner than later than they originally thought. So that's just one of the unfortunate things, and that's the reason why the Biden administration has sort of made this. They want people in the marketplace. The more people that are healthy and younger, they're outside of the marketplace, that's what drives premium, right? And so they want, like all insurance, if you think of group insurance, we love the 25-year-old employee compared to the the single guy or single woman compared to the family of four and the guys in his upper 50s, and issues start to happen. So a lot of that drives those rates. So that was the intention here. So
Yeah, it's in-force plans stay in force. So follow up to that is, what if we write a new short-term plan on 12/31? Would it be 364 days? You want to talk on that, Brad?
It would absolutely be renewable, right? Or it would be for that whole, but
Right.
the rule,
It would run the full 364.
yeah.
It
So
would run the full 364.
just don't want to leave anybody in the middle of the year or at any period other than the year, because now you're getting them into the next, the 2025 ACA enrollment.
Right.
So it's just those mid-term or mid-year
Yeah, you could
expiration.
maybe take somebody into December of next year, and then of course you could write them a 1-month short term, according to the rule. So do all your business in 2023. That's the public service announcement in terms of the short-term rule. Jess got a question. If the proposed rule for short-term goes through, what would happen to someone that bought a 12-month plan before
That's
2024?
what we just talked about.
Just answered it. Yeah.
Yeah.
Okay. Robin's got a question. I think she's alluding to income, an ICRA. So her question is, isn't money considered income for the employee on the ACA? ICRA monies, that's the key point, but ICRA. So ACA subsidy or ICRA stipend, or can you use both?
So I'm stumped on that one, unless somebody from the team could jump in and
Okay.
speak to that. I don't recall that it is.
Okay.
But I've been known to be wrong on occasion.
Yeah, so I think as I read this more, money considered that they get from the ICRA.
Their funding, their ICRA funding, their HRA, is it considered income?
It's tax deductible.
Yeah.
So it's tax deductible. Hopefully that answers your question. Okay, let's touch on, can you take the next one? With
Gary's
questions, yeah.
So the only one carrier that we're familiar with that allows members to go out to other states is Ambetter. That's the only one I know of. So all are restricted to the state borders. There may be a couple of exceptions in those areas, like so in the Toledo area, they may be able to go over into that next county, I believe. Classic one I know is down in the Belmont County, Martins Ferry area, Wheeling Hospital. So they can go just over the border to Wheeling Hospital, but there are pretty big limits on that. So Ambetter is the only one that we know that they could visit a network provider in another one of the Ambetter service area states. Aziz is asking, are there Aetna plans for Kentucky? I don't think we got that, right? No, they don't. They are in Indiana, though, I think we learned. So sorry about that.
Yeah, they're in Indiana. They're across Indiana, Illinois. as well.
All
So
right.
we don't have all the intel on the Indiana plans yet.
Yeah.
We have the Ohio, and again, they're late, very late to the party. They just announced their their plan rollouts this week, and they're doing one with us tomorrow. So stay tuned, check it out tomorrow. Okay. And again, we want to point out there's so much info, 10 pounds of potatoes in a 5-pound bag, and we are just seeing it as it comes. I mean, it's coming at us like a freight train. So the next question is
This short-term rule goes back.
okay, Jennifer.
I'm just reading.
Okay, let's get to Jeff's. I think we answered Jeff's question.
Yeah.
We're pretty much caught up. Let's ask about ICRA. Is ICRA available for groups over 51? Yes, it is. It is.
Yeah.
It is. ICRAs are available for groups over 51. It's a very flexible plan. You can look at small group, large group. You can look at different classes of business. We're going to be doing a deeper dive into ICRA in the coming year. It's a fabulous tool. And, the thing to remember is with ICRA, you can either take the company stipend they're giving you for your ICRA, or you can, opt out of the ICRA and look at the marketplace and see if your income actually generates a better deal through the ACA. So, ICRAs are very powerful. In fact, the state of Ohio uses one for OPRs, and we've seen some other retiree groups use them. I think Whirlpool uses one. There's some other, I think some state teachers are looking at it. But okay, so you
Yeah,
want to
Lisa
answer
asked a great
Lisa?
question.
Yeah.
And Jeff, you're my my government guy. So the question is do you need to obtain a new consent form for all of your existing clients? But I think the answer would seem like yes, because it's, although it renews for the client,
Yeah.
but what doesn't
Yeah.
renew is their subsidy. Their subsidy may change. So with ACA members, you have to go in and touch each renewal.
Yeah.
And so you're talking to them. So I would
Yeah.
just capture the consent while you're there, update any income amount to see if their subsidy goes up or down, as well as everything you do to like sort of check to see how if their current plan continues to work for them or if they want to shop.
Yeah, and I just want to point out that it's been a law for the last couple of years. They decided to start enforcing it on June 18th. Okay, so it's they're using this as a tool, this existing requirement. They're using this, they're putting some teeth behind it. They're using this as a tool to look at agents who aren't doing this, because there's a lot of agents out there who are kind of unscrupulous, and they're out there stealing clients, to be truthful, by using fast and loose tactics, calling somebody up, and putting you on a plan, or finding information on the dark web and enrolling people without their consent. There's a lot of nefarious things going on. So this is a way to stamp that out. Okay, and we're seeing this also on the Medicare side, as you're all well aware of that. So this is just an aspect to address this, and yeah. So if that, if you have more comments on that, let me know. But they do want a scope on your clients, all your clients. Okay. Who else do we have? We've done a pretty good job here.
Wait, did we answer? There was a question from Jennifer that's kind of right there in the middle, but I don't know that we.
I think we did.
Okay, we covered it.
If we write in a short term in on 12/31.
Yeah.
Okay, so we're anticipating that the law would take effect 1/1. Okay, just stay tuned. I don't know what the cards are going to be, but they could preempt us and say December 15th this law is in effect. I think it'd be really stupid for them to put it off you know, off target like that. So don't quote me, but I think it's going to be 1-1. So just keep that in mind. Any more questions, guys? We've prattled on for more than an hour, and this will be recorded. And I really appreciate you joining me. And I apologize for, my intermittent coughing and all that kind of thing. But Brad, do you have any final thoughts?
Happy selling. It's upon us 1 week from today, and I know many of you are already hot and heavy into your Medicare annual enrollment period. So you'll be juggling a couple of balls for about 6 more weeks, 5 more weeks, 6 more weeks. So good luck. We wish you well. We're here for you whenever you have anything that you need, whether it be that referral. Let us know and we could help get you set up with that. If you've got that one client who just decided to move to Utah, spur of the moment, and you don't want to go through the hassle there. But if there's any carrier that you have seen that you're not currently contracted and you think you need to get contracted with, again, let us know. We'll try to get that process expedited via our contracting team. But it's a two-way street there, gang. When Sandy Weber sends you the links, most of them have an expiration date, a short expiration date, maybe a week. So if you want it, you gotta, I know everybody's got a ton going on, but you have to be faithful and get that completed pretty darn quick. So that's all I want to talk about on that. So lots of options. We're here for you. Just let us know.
We just scratched the surface, guys. Call us, email us. We're your resource. Happy selling, everybody.
Take care. Bye, everybody. Thanks for joining. Really appreciate you being on.